All right, let's get into it. Today, we are taking a deep dive into retinitis pigmentosa, or RP. We're going to look at the incredible new ways scientists and doctors are trying to fight this condition, which causes progressive vision loss. You know, this phrase is often how people describe the experience of RP. It's this feeling of the world slowly closing in, dimming from the outside. And for those living with it, that's not just a line of poetry, it's their reality. It really helps us connect with the human side of this before we get into all the science.
And make no mistake, this isn't some super rare thing. We're talking about 1 in every 4,000 people around the world. That makes it one of the main reasons for inherited blindness among people who are still in their working years.
Okay, so what exactly is retinitis pigmentosa? Let's start there. In this first part, we'll cover the basics, what the disease is, how it tends to progress, and why it's been so darn hard to treat. So, right off the bat, the most important thing to know is that RP isn't just one disease. It's actually a whole group of different genetic disorders. But they all have one thing in common. They cause the light-sensing cells at the back of your eye, in the retina, to slowly break down over time. And the way vision loss happens usually follows a pretty classic pattern. It almost always starts with having a hard time seeing at night or in dim light. Then the peripheral vision starts to go, which gives you that feeling of looking through a tunnel. From there, for a lot of people, it can eventually start to affect the central vision, the vision you need to do things like read or recognize someone's face. Now, here's the real kicker for the researchers. It's not like there's just one single faulty gene they can target and fix. Nope, scientists have found over 80 different genes that can cause RP. This huge genetic variety is exactly why finding a one-size-fits-all cure is so incredibly challenging. It means we need a bunch of different strategies. So with all that complexity, one of the most exciting strategies is to just go after one specific, well-known type of the disease at a time. So let's look at how this kind of precision medicine is being used for a really severe form called XLRP. So XLRP, that stands for X-linked retinitis pigmentosa, is caused by mutations in just one gene, called RPGR. Now, it only makes up about 5 to 15% of all RP cases, but it's often a much more severe and faster progressing form, especially in men. That's why it's become such a high-priority target for gene therapy. And this hunt for a treatment has really boiled down to two major players in the final stages of clinical trials. You've got Johnson & Johnson's drug Botavec, which is in phase 3. That's the last big step before you can ask for approval. Now, it didn't hit its main goal, which was based on a mobility test, but it did show some really encouraging signs on other measures, like improvements in retinal function. Then you have Beacon Therapeutics' Lerazuva. It had such good data in its earlier trial that it's now moved on to its own big final trial. This is really where the action is right now for XLRP gene therapy.
Look, going after single genes like RPGR is a fantastic strategy, but remember, we've got over 80 potential culprits. So that raises a pretty big question, right? How do we help the other 85 to 95% of patients?
And that question leads us right into our next big topic, universal therapies. These are sometimes called mutation-independent because they're designed to cast a much wider net, offering hope to almost everyone with RP, no matter which specific gene is causing it. And maybe the most futuristic-sounding approach here is something called optogenetics. So the idea starts with a basic fact about late-stage RP. The eye's original light sensors, the photoreceptors, they've stopped working. But there's often a deeper layer of cells in the retina that's still perfectly healthy. The only catch? Those deeper cells can't detect light on their own. So the goal of optogenetics is just brilliantly simple when you think about it. You use gene therapy to deliver a special light-sensitive protein to those healthy surviving cells. You're basically teaching them a new trick. You're turning them into the eye's new light sensors, completely bypassing the layer of cells that was damaged. And I know this sounds like something out of a movie, but it is happening right now. A therapy called MCO-010 is so far along, its creators have already submitted it to the FDA for approval here in the US. And there are other ideas too. OCU-400 tries to stabilize the whole environment inside the retina. Another one in Japan uses a specially engineered protein to do a similar job. These are all potential game changers because they're designed to work for just about anyone with RP. So, while all of this amazing science is pushing forward, we can't forget about what can be done for people right now. And that's where holistic care comes into the picture. It's all about managing the condition and making life as good as it can be today. You see, good care is about so much more than just medicine. There are proven strategies, like visual training, which can help people learn to use the vision they still have more effectively. Special lenses that filter out certain types of light can cut down on glare and might even help protect the retina. And of course, technology gives us amazing tools, from electronic magnifiers to wearable devices that help with navigation.
And we absolutely have to talk about the psychological side of a diagnosis like RP. It changes your entire life. In fact, research, like the RPDIG study in France, has shown that getting early and consistent support, even just from a trained nurse, can make a huge difference in reducing the anxiety that comes with this journey.
Sociologist Michael Thurston actually came up with a model for this emotional path. It sort of maps out the journey, starting with that initial shock and maybe trying to hide the condition, moving through grief, and then into a phase of rebuilding a new life and a new identity. And the final stage he calls transcendence. That's where a person starts using their experience to help other people. Understanding these stages can be so important for patients and for their families.
You know, this quote really nails it. This is what modern care is all about. The future of managing RP isn't just about waiting for one miracle cure. It's about a whole team, doctors, therapists, social workers, all working together to care for the entire person, not just their eyes.
So as you can see, we're fighting this disease on so many different fronts. We have these super precise gene therapies for specific types, these broad universal therapies that could help almost everyone, and a real growing focus on holistic care for living in the here and now. The question really isn't if a breakthrough will happen, but which of these amazing paths will be the one that truly changes what it means to live with retinitis pigmentosa. Thanks so much for joining me.